So both her hands look the same size. Symmetrical. Color is even. It's a dark brown color. And I'm gonna palpate to see if there's any pain, any swelling, or any masses. And I don't know any. Let me see this one, this arm. Same thing on this side. And there's no, are you feeling any pain?
No.
No, okay. So I don't feel any swelling. There's no swelling. There's no masses either on her hand. So no deformities, no redness, no swelling, which is a normal finding. And now we're going to look at, have the patient, let's see. We're going to look at the fingers. So we're going to have the patient abduct fingers like this. Okay. This is adduct. And this is adduction as well. We are going to have the patient put the thumb away like this. Put it close to your fingers. Put it away, close, away. And we're going to have them touch the finger to the palm. Touch the thumb to the palm. Put it away. Take it out. Okay. Alrighty. And one more thing. We're going to go like this for flexion and like this for hyperextension. Okay, perfect. So all of that, there was no limited range of motion with those. The next thing that we will be doing is we're going to be inspecting the hips. Okay. We're going to turn around completely. All right. Back up a little bit for me. Okay. So what we're looking for is to observe the concavity of her thoracic spine, which she does have. It's concave. The convexity of her thoracic spine and the concavity of her lumbar region, which it is. We're going to palpate for stability, tenderness, and crepitus. Her buttocks should be equal in size. Her iliac should be symmetrical in height, hips stable and non-tender and without crepitus. So we did this earlier because we checked her buttocks are like even, symmetrical. We palpated to make sure that it was not tender, and checking for crepitus, their instability. We did that. If there's any abnormalities, it could be due to common like injuries of the hip and groin, which is common in athletes who pull like their hamstring. All right, I'm gonna have my client sit back down. Sit down for me. And we're gonna look, check the knees. 1 second. Okay. So we're gonna have, typically you'd have the client lie down for this. So we're gonna raise the knee up, raise her legs up, straighten it out, and we're gonna bring it back down. Okay. That's Do you have any pain when I do that?
No.
Okay. So if she was lying back down, we could raise the leg further up about 90 degrees. So this is her lying back down. We raise the leg up 90 degrees to make sure that there's no limited range of motion. And then we would have her with her legs raised 90 degrees. We would have her bend her knees like this to extend it. I'm sorry, to check for hip flexion. And again, with the client lying down, we would do the same thing to check for abduction and adduction. So her legs would be flat like this on the bed, and we're gonna abduct and bring the leg back in, adduct. And it should be about a 30-degree angle when you're doing this. And then we could have her lay on her stomach. We're gonna have the leg, bring the leg back and bring the leg up and down, and to check for hyperextension of her leg and hyperextension of, to check for internal and external rotation and hyperextension of her legs. All right, now we're gonna inspect and palpate the knees, okay? We're gonna inspect the knees. Typically you want the knees exposed to do this. To look to see if there's any signs of inflammation, any scars or anything like that on the knees, which could indicate that there was some kind of a previous surgery. We're gonna palpate the knees to see if there's any swelling, any pain. Do you have any pain?
No.
Okay, good. We'll do that on both sides. We're going to check the range of motion of the knees. Okay. We're going to bring it up, down, up, down. Do the same thing on the other leg. Up, down. Okay. And I did not know any limited range of motion, so the movement was fluid. She seems to have strength in both knees, so that's what we're looking for. And we do not want, let's see, we do not want any tenderness or pain or any hot or swelling of the joints. So everything that we felt and saw was normal. Now the last thing that we're going to look at is the feet, okay? And with the feet, we're checking to see if what you're going to inspect, we're going to palpate, and we're going to do the range of motion. We're going to have the patient point the toes upward, point them downward, outward and inward. We're going to have her rotate her foot outward and inward and turn the toes under her foot. Okay, so pointing the toes upward. Okay. Pointing the toes, let's see, up like this. We're going to point the toes upward, okay? And that is dorsiflexion. And when we point the toes downwards, that is plantar flexion. When we turn the feet, the sole of the feet in, the sole, I'm sorry. We're gonna turn the sole outward. That is eversion, which is like this, okay? Like this. And then we're gonna turn it inward, which is inversion.